Natural Health Tricks 24/7, brings health to patients, restore health holistically. Kidney transplant. One of the treatments for patients with kidney failure, which leads to end-stage renal disease, is kidney transplant. What happens before a kidney transplant? You will need to take medication every day to make sure your immune system doesn't reject the new external link of the kidneys. Also, you will need to see your health care provider regularly. Positive kidney transplants perform better waste filtration and keep you healthier than dialysis. However, kidney transplant is not for everyone. The doctor can tell you that you are not healthy enough for transplant surgery. For a kidney transplant, you need to. If you want a kidney transplant, the procedure involves the following steps. Tell your doctor or nurse you want a kidney transplant. Then, your doctor will refer you to a transplant center to check if I am well enough to receive a transplant. At the same time, living donors need to be checked to make sure they are healthy enough to donate kidneys. If you do not have a living donor, the patient will be put on a waiting list to receive kidneys. On the other hand, you will have a monthly blood test to treat and wait for your kidneys. You must go to the hospital for a transplant as soon as you know your kidneys are available. If you have a living donor, you can schedule a transplant first. Talk with your doctor. The first step is to talk with your doctor to find out whether you're a candidate for a transplant. When you are on dialysis, your dialysis team will also be part of the process. And when your doctor thinks a kidney transplant is right for you, your doctor will refer you to a transplant center. Then, check at a transplant center. At the transplant center, you will meet members of your transplant team. You will have tests to make sure you are a good candidate for transplant. Tests will include blood tests and tests to check your heart and other organs. At the same time, you'll also have tests to check your mental and emotional health. To make sure you're healthy enough for surgery. Some conditions or illnesses could make a transplant less likely to succeed, including severe heart disease, advanced age, alcohol or drug abuse, dementia or poorly controlled mental illness, active or recently treated cancer. Any other factor that could affect the ability to safely undergo the procedure and take the medications needed after a transplant to prevent organ rejection. The transplant team must be sure you're prepared to care for a transplanted kidney. Certainly, you must understand and follow a medication schedule you need after surgery. In a process called cross-matching, the transplant team checks the donor's blood for your blood to help predict whether your body's immune system accepts or rejects new kidneys. When a family member or friend wants to donate kidney and is a good match, we'll also need a physical test to ensure that he is strong enough to become a sponsor. Testing and evaluation at the transplant center can take several times over weeks to months. If you have a living donor, you don't need to be on the kidney waiting list and be able to schedule surgery when best suits you. Waiting list for kidney transplant. When your tests show that you can transplant, your transplant center will add your name to the waiting list. Waiting time can range from several months to several years. Most transplant centers give priority to those on the longest waiting list. Other factors, such as your age, where you live and your blood type, can make you wait longer or shorter. A transplant center may put you on a waiting list for a kidney donor if your kidney function is 20 or less, even if you are not on dialysis. While you are waiting for a kidney transplant, you may need to start dialysis. Monthly blood test before a kidney transplant. While you wait for a kidney, you'll need monthly blood tests to constantly use medication to treat your kidneys. The center must have a recent sample of your blood to match with any kidney that becomes available. Kidney transplant. During kidney transplant surgery, a surgeon places a healthy kidney into your body. You'll receive general anesthesia before the surgery. And the surgery usually takes 3 or 4 hours. Unless your damaged kidneys cause infections or high blood pressure or are cancerous, they can stay in your body. One surgeon will remove the kidney from the donor, while another prepares you to receive the donated kidney. Surgeons usually transplant a kidney into the lower abdomen near the groin. If you're on a waiting list for a donor kidney, you must go to the hospital to have your transplant surgery as soon as you learn that a kidney is available. Thank for watching. Good health.